Thank you, Chris, and it's a pleasure to lead this session on digital therapeutics, their current and future opportunities. It's my pleasure to introduce this esteemed panel. We have here Priya Abani, who's the Chief Executive Officer of AliveCor, which is a leading digital diagnostics medical-grade EKG company. We also have Julia Hugh, who's the CEO of Lark Health, which is a leading integrated chronic disease prevention management platform. And also Dr. Dawn Sugarman, who's Assistant Professor of Psychiatry at Harvard Medical School, and also a psychologist in the Division of Alcohol and Drug Abuse at McLean Hospital. Before we get started with some questions, I'd like to say that we are going to be talking about digital therapeutics, which are evidence-based, software-driven solutions for the prevention, diagnosis, treatment, and management of diseases. And we're going to be discussing how the COVID crisis has affected and also provides opportunities to maximize the utilization of these therapies. I'd like to start by turning a question to Priya. Priya, if you can talk a little bit about the landscape before the COVID crisis and how your digital diagnostic has been used and what you see has been a major impact of COVID on the utilization of your technologies.
Sure. Thank you, Hadine. A pleasure to be on this panel with you. So digital health was growing before, and the fact is that now it's growing even faster. COVID-19 has placed this issue under a spotlight, and there is absolutely no question that this pandemic is acting as a forcing function for the digital health movement. I think that physicians and health systems now have no choice but to focus their efforts on digital and remote patient monitoring in order to provide care for the patients outside of the examination room all the way to their homes. And while this adoption has been seamless, we are seeing a promise, and hopefully this will help us make a big impact. The one line I want to use here is like, every effort that we make in progress during this time and the learning from this time that we make today should have the aim of correcting this for the future.
Yeah, thank you. And can you be specific about the technologies that you have and what the uptake and utilization has been by the frontline workers and the both inpatient and outpatient clinicians and their patients?
Yeah, so specifically what we are watching is, we provide medical grade EKG devices. And one of the things that we are observing is healthcare providers adopting our KardiaMobile 6L device to monitor the COVID-19 patients, either in the hospital or from home. Many of these patients have been prescribed medication that may cause QT prolongation, which is a heart arrhythmia, which may lead to sudden cardiac arrest. And our devices allow patients to take a medical grade 6-lead ECG and automatically share it with the patient's care team. Now, before, you would have to go to the hospital to get your ECG taken. You would have to go to the specific room where the ECG was taken. And the fact that, even for chronic diseases, the patient can now take their vitals and communicate with their doctors from their homes or from anywhere which is not their office is a phenomena that we are watching happening. And obviously, we want to prep the world to be ready for telemedicine.
Yeah, thank you. So let me turn to Julia now, and I wanted to ask you about your platform and how it was utilized before the pandemic and how the opportunities for personalizing care and improving access to care for monitoring chronic diseases can be optimized through your platform.
Thanks so much, Hadine. Prior to the pandemic, I would say that the last 2 years have been marked with, kind of cautious optimism by our partners, as opposed to now, which is more of a burning need. And I would say for us, so Lark is an AI chronic disease management and prevention platform. So we've got close to 2 million patients now being treated 24/7 on demand, real time care done by text message based counseling based on all of the healthcare data that is consumer generated and texted to us. With all of the devices and health monitor data streaming in. And so prior to the pandemic, we've been working with 3 of the 7 largest national health plans, working with a lot of regional health plans, managing their chronic patients and trying to prevent them. With COVID, I would say, we're just seeing incredible growth opportunities. As horrible as COVID is, I think, the pandemic, I believe, will do more for accelerating virtual health and telehealth than anything in this generation. And I see that from both a regulatory side, from a supply standpoint, as well as from a demand standpoint, the user experience and adoption. So, for us, it's been really encouraging to see that we have a role to play as a virtual health provider, and we've been, really working very hard with our partners to scale that.
Yeah, thank you. So I want to turn to Dawn, who has some related work in terms of thinking about maximizing access to care and engaging patients in substance abuse and behavioral health care. And one of the things that we've noticed that's been tragic and striking is the huge uptick in mental health needs and crises, and also substance abuse conditions. If you can comment a little bit, Dawn, about some of the emerging technologies that you and others are working on to address these issues.
Sure, thank you. I would just preface by saying that, so the area that I'm focused on is substance use disorder treatment. And before the pandemic, we were already dealing with multiple crises. So the most obvious being the opioid epidemic. In addition to that, we're also seeing alarming increases in alcohol use disorder, and problematic drinking. And yet we know that less than 10% of individuals who need treatment for substance use disorder actually receive treatment. And so that's an area where there was a lot of recognition that digital therapeutics could be really helpful in addressing this treatment gap and increasing access to care. And so in that vein, several evidence-based programs have been developed. The probably most notable for our field in substance use disorder was that in 2017, the FDA approved the first digital prescription therapeutic for substance use disorder treatment, the Reset app from Therapeutics, and that can now be prescribed by a clinician the same way that they would prescribe any FDA medication. So this was a rapidly developing field prior to the pandemic, and we expect that there will be increased need as we go forward. And so some of the areas in particular that I, in my research, have focused on is addressing treatment gaps, particularly for women. So we have evidence-based group treatments for women that we know that women who are provided with gender-specific treatment, meaning that treatment that focuses on their individual needs, the barriers to treatment that women face, including increased stigma. They have a more accelerated course of illness than men. And they also have barriers to accessing care, like childcare and things like that. So when they're provided with gender-specific treatment, they generally do better in treatment, but they present to mixed gender treatment programs that do not generally have the resources to devote to women-specific programming. So what we've done in my research lab is develop an online gender-specific platform for women to address their needs as a way to augment treatment. And we found in our pilot studies that women were really satisfied with this treatment, and that we're in the process now of adapting it based on the feedback that we've gotten. But I think that, there's several areas within substance use treatment where we can use digital therapeutics in this way to reach some of the more vulnerable populations.
Yeah, fascinating to think about the ways in which you can tailor and personalize treatment for individual populations that really need access. Julia, let me take this back to you and see if you can comment a little bit more about the workflow as we increase, again, in-person visits in clinical care, but also utilize and incorporate these platforms and digital solutions. And can you sort of articulate the way you see us going forward to use both a combination, both at the patient level and also at the clinician level in terms of integrating these methodologies?
Yeah, absolutely. It's, from a chronic patient perspective, as we look at COVID, close to 90% of all COVID deaths, I've heard, are chronic patients. They have one chronic condition, which just means there is so much need for us to provide personalized care at home, keep these patients safe, and prevent them from being exposed to COVID as much as possible. And so I see that as one population. The other population, of course, is getting high-risk patients care that they need. So in terms of a user experience, I think it's really critical to get them care virtually in a personalized way when and where they need it. And so, with the patients at home, we've found that being able to work around their schedule, so text messaging with them at midnight when they put their kids to bed and they have a little bit of time to chat. We see almost 46% of all of our text message-based interactions between 9 p.m. and 9 a.m. in the middle of the night. And so for me, I think it's really about how do you, deliver devices, medical monitors to patients at home? How do you deliver medication to patients at home so that they can receive their care and not have to kind of delay, care while sheltering in place? I think that also creates a lot of interesting opportunities for providers to then get pushed relevant data into their EHRs and their workflows through escalations to telemedicine and deeper healthcare data partnerships. And I see a lot of promise being done there with interoperability acts and so forth.
Yeah, this really dovetails with some of the work that Priya, you're working on in terms of the 24/7 coverage and the sort of access to real-time ecologically based data. And I wonder if you can comment on that with the AliveCor's models and work.
Yeah, no, I want to actually echo what Julia said, and something that we discussed even before the panel, right? So I think digital health is and telemedicine is here to stay, and our healthcare system will have to adapt to it. Two things that we are doing from an AliveCor perspective is, make sure that the devices are more accessible, meaning they are easy to use, they are affordable, and they're reliable, correct? Second is streamline the workflows so that the healthcare providers can implement these devices and the therapies efficiently, and more importantly, very safely for their patients, right? So at AliveCor, we're focused on, creating solutions that scale. We want to be the providers of cardiological care to anyone, no matter where they are in the world at the moment they need it, right? Again, it kind of, it goes along with our mission of allowing a few to take care of many in the most efficient way. And I think it's important for the patients and their families to have this peace of mind, knowing that the patient can receive reliable, convenient healthcare from the comfort of their home, which right now is, it's in many cases, we're just learning and we're setting up these paradigms, but we have to shift to them very soon.
Yeah, this also comes back to the work that Dawn is doing, where you're talking about clinicians and extending clinicians with some of the tools. And Dawn, I wonder if you can talk about the ways that these technologies allow clinicians to take care of many, as Priya said.
Mm-hmm. That's a great point. So, with the digital tools that are available for mental health and substance use disorders, these are not replacing the therapy that we do, but they're clinician extenders, as you said. Generally, patients are engaging in either a mobile app or an online program, and then there's a clinician dashboard that goes along with that. And these are asynchronous in that the patient and provider can engage with them in their own time. And what that really means for patients is that they almost have like a therapist in their pocket. So when they're struggling, it's something that they can turn to on demand 24/7 rather than waiting for their next therapy session. And for clinicians, it can really help optimize the care that they're delivering, in the sense that many of these programs focus on cognitive behavioral strategies. So teaching patients how to develop coping skills. So things like recognizing and challenging negative thoughts, identifying triggers, learning drug refusal skills. And those are really repetitive behaviors that are really amenable to a digital platform that can be used outside of the traditional treatment setting. And that leaves the clinician's time with their face-to-face or telehealth visit with the patient to focus on some of the more challenging issues that require that interaction. So it helps them really optimize the care that they're delivering. And they also have access through their clinician dashboard to see how the patient's doing, so that they can, again, tailor their individual sessions to areas that require the most need.
Yeah. So each of you is really working on conditions that are not an acute crisis right now with the attention of COVID, but they are, hugely important for both long-term health and crisis management. And one of the concerns we hear in the news is that there's an underutilization of healthcare services for important conditions like the ones you're all working on. And I wanted to see if you, perhaps Priya, if you can start, and if others have comments about this as well, about how important it is to ensure that we provide access to care using some of these remote platforms for people who are not reaching out at this time.
Yeah, I'm going to use this question very, I'm going to use this in a forward-looking statement, right? So whether it is the reemergence of COVID-19 this fall, or unfortunately something else hits us decades down the road, I do think the healthcare system has much to do in order to successfully navigate a pandemic like this, right? And as you mentioned, this period is a training period for us. We are adopting new workflows, and we are teaching people new styles of telemedicine, which ideally we should have been either have implemented or have been used to doing both as a healthcare system and the patient base before such a thing hits us. So we have to build the infrastructure and workflows now so that our system can respond better to a crisis like this in the future. And obviously, we need more equipment for hospitals, whether it's PPE or beds. But we need to prepare our consumers to live in this world of telemedicine, and how to take care of themselves, how to take their vitals from from home and work with the doctor from home. So we are doing everything we can right now to provide the devices and the infrastructure, but there is a lot of work to be done.
I completely agree.
Yeah, Julia, if you want to comment.
Sorry, I jumped
Go ahead,
again.
Julia.
Yeah, I completely agree with Priya. This idea that we are pulling ourselves into this new world, and this new world will look radically different, that the healthcare system is encompassing virtual health and telehealth. And And so, I think one of the things is, even though the diseases that we take care of, prediabetes, type 2 diabetes, hypertension, those are not, in the most acute, highest issue right now, which is COVID. One area, for example, we've been working on a AI therapist, a digital cognitive behavioral therapy provider for the last year, and we literally launched it about 2 weeks ago. And I feel very lucky that we could launch it at this time, because 70% of folks in the employment space have been sharing that this is the most stressful time in their work lives they've ever encountered, which is pretty staggering. So for us, these types of issues, while they are not COVID centric, are byproducts of COVID that need to be taken care of. And so, the part that we were playing is, because we have a lot of AI ability, where, we've been offering COVID aid and free AI therapists for our partners. And that's been very well received.
I wish we had more time. I'm sorry, Juliet. I wish we had more time. You all are doing such important work in this space to really shift to a personalized, patient-centric kind of approach that really optimizes all the tools available to us for the care of the population. So thank you all for your time and for your important work.